I can help her.
Very good. Okay. So if both of you are ready, can I start the timer?
Yes.
All right. Starting, and here is the question. Once you've read, tell me, I'll move. Because I'm not going to give you 9 minutes. I'm going to only give you 1 minute. Yes, RTA?
Yeah.
Yes. Next. Is this coming in your way?
No, it's fine.
Okay. Once done, tell me, please. I have to move on. Yes?
Yes, ma'am.
Yes.
Yeah.
So, yes. Once you're ready, then tell me, then I'll start the timer for next discussion.
Can when I'm presenting it, can I just have the previous slide
You
as
can
well?
ask me. I'll do it.
Okay.
I'll put this, and then when you, this is communication skills.
Yeah. Okay.
So if you've read and understood, kindly begin your
Yes.
station. Yes.
Okay. Hello, my name is Dr. Mavish. I'm one of the surgical candidates today. I'm calling to speak with the trauma consultant on call to update about a patient who is 20, who came with the road traffic accident. Can I confirm I'm speaking to the trauma consultant on call?
Yes, I'm the trauma consultant. Please, could you summarize your case?
Yes, so Mr. X is 20 years old who came with a road traffic accident. When he came, he was initially unconscious, and he had a right tibiofibular open fracture with. Ma'am, can we move to the next slide?
Yes, please. Yes. Yes. Here. Sorry.
He and abrasions on the left flank. He had a cold and pulseless extremity, which is probably is a compartment is basic. It looks like a compartment syndrome. Um, Hemodynamically, the patient is stable. We have done an ultrasound scan, which is showing the fluid in the paracolic gutter, and the all the investigations are normal except the CRP. This is I would like to update you about this patient.
All right. So, what is your plan of management now?
So for this patient, there are two things that needs the urgent attention. One thing is the patient might be having bleeding into his abdomen. That is why there is fluid, and there is the abrasions and on the flank and tenderness. And the most important thing, the other one is the extremities pale, cold, and pulseness, which could be because of the either acute limb ischemia or could be the compartment syndrome.
Okay. What is the most urgent? Which is the most urgent at the
So the
moment?
patient's limb is the most urgent at the moment because it is at risk of going into limb ischemia.
Why do you think that it might go into limb ischemia?
Because the patient's extremity is cold, pulseless, and there is an open tibiofibular fracture
With the
because
natural
of the
damage.
because of the
Okay.
compartment syndrome.
Okay. Is the patient wearing a cervical collar?
I am not sure then, but I can check it for you.
Okay. And do you feel the patient is dehydrated?
I'm not sure, but I can check it for you.
Okay.
Good.
Uh,
What do you want to do before sending the patient to OT?
So I would like I would like to inform the orthopedic consultant about the tibiofibular fracture. I would like to start the resuscitation of this patient by giving the patient IV fluids and possibly arrange for the blood. For this patient, I would also like to do a CT scan of his abdomen and pelvis, and also I would like to do a CT scan of his brain.
Any blood test you would like to send for?
As I would like to send the patient's blood for the so blood investigations are there, but I would like to also do the ABG for this patient. I would also like to add on a lactate and blood group cross match for the blood to be arranged, other than the normal investigation.
Okay. What will you do for the wound?
Very
Open
good.
wound. What would you like to do?
So I would so the open wound I would is with the gross soilage, so it needs to be splinted. It's a fracture.
Okay. How would you manage the wound, the open wound right now?
We need to be debride this wound first.
Yes.
So they need the
Okay.
debridement, and then it needs
All
the
right.
and it needs the cleaning, and then for the definitive management, the patient's fracture needs to be fixed. For that purpose, I would like to speak with the orthopedic consultant.
All right. How would you fix his fracture?
It will be the external fixation for this fracture. Also, because I think the pulses are at pulse is at risk. Oh, sorry, the vasculature is at risk. I would also like to do a duplex ultrasound of this patient's leg.
Okay. All right. Who would you want to involve in this case?
The orthopedic consultant.
All right.
And then and the orthopedic consultant and the
Maybe general surgeon as well.
general
There is
surgeons,
less
general
time.
surgeons,
Yes.
and anesthetist to come and review, anesthetist to come and review,
And
and the vascular surgeons.
very good.
And
Maybe
okay.
ITU.
ITU registrar for the
Yes.
And
And one more.
Okay, so the plastic surgeon,
Plastics.
because
Yes,
plastics, yeah,
please.
because it's an open
yes.
tip fracture, yeah.
All right. Thank you.
Why do you want to involve
Okay.
plastic? She answered, right? Okay, good.
Yes.
Because
Why do
it's
you
an
want
open,
to involve the plastic surgeon?
because it's an open fracture, we will need
All right. And why do you
management.
want the general surgeon involvement
Because the
here?
patient has possibly they have the intra-abdominal bleeding going on, so abdominal distension tenderness needs the laparotomy or something definitive.
Okay. Yes. All right then. Okay. Thank you.
Do you need anyone to call pre-operatively or intraoperatively?
No, she already said that, ma'am.
She said, okay.
I already said
The
who
plan.
she wants to involve.
Yes.
Yeah, plan also she has said with the plan of management. Both of them together she
Yes.
has combined.
Anything else?
And okay.
About CT?
Yeah, after I said that I would like.
Yes, she said CT also, ma'am.
Yeah.
Okay.
CT is she wanted to do CT and then NRG.
Antibiotic energy.
Any
So,
other?
just to summarize, I would like
Yes.
to inform the orthopedic consultant. I would like to inform general surgeon, and also to involve the ITU registrar and anesthetist and the plastic surgeons for this patient's case. The first line of the most important thing to be managed here is the open tibiofibular fracture with the vascular injury that needs the urgent attention, and the open tibiofibular fracture will need the debridement, antibiotic, and then also need the external fixation, and later on the grafting by the plastics. The abdominal distension needs further investigation by the general surgeon, and if needed to be a laparotomy and the sorting out the intra-abdominal bleeding. The pulseless lymph needs the arterial duplex or CT-MR or the MR angiography. CT angiography, MR angiography to see where it is the injury, and then needs repair by the vascular surgeon.
So how would you manage
right.
the free fluid in the abdomen?
So the free fluid in the abdomen, it needs the general surgeon needs to see if there is any intra-abdominal bleed or collection.
So it's an indication
And
of laparotomy.
Is laparotomy,
Of-
yeah. They need to do
Yes,
laparotomy.
laparotomy.
Emergency laparotomy. Good.
All right. How are we understanding that there is free fluid in the abdomen?
Because the ultrasound was
did
done.
yeah, and why did you do an ultrasound?
As a part of the ATLS protocol, we did a fast scan because the patient abdomen was distended and it was tender.
Very good.
And there were abrasions. Were there any
yeah.
abrasions?
Yeah, there were abrasions
okay,
at the
this
left
could
side.
suggest that there is possibly
Intra-abdominal bleed.
Very good.
Due
Excellent.
to splenic injury, perhaps. Yes, on the left
Yeah.
abrasion. All right. All right. Thank you.
Thank you.
Yes, Dr.
Thank you.
Abhishek, tell.
Yeah, Dr. Rajiv, actually, the protocol is maintaining like if the patient is hemodynamically stable or unstable. If unstable,
Yes.
immediately go for laparotomy. If stable, then we will have to do the imaging, and if there is like more collection, something like that, then we can decide and do laparotomy for this patient. So actually, the further imaging will tell us that laparotomy will be required or not.
Yes.
But in this case, I think that more focus should be on the vascular injury
Of
of the.
course, of course,
Yeah, so
of
if we
course.
Yes.
That's
just
why
do
you are
it first and then yeah, then
That's why you're talking to the trauma
RTA
consultant.
consultant, yes.
Yes.
yeah.
I think this station also came, right? Or maybe not.
no, it was an ischemic limb that came.
Ischemic limb.
Yeah,
It
Okay,
was
not
the
RTA.
vascular consultant. Ma'am, it was the vascular
Okay,
yeah, it was
consultant.
vascular
okay.
consultant.
It's too different actually. It's just keep updating your consultant on call.
Yeah,
That's it.
yeah. Little different, but anyway, we'll practice that again one day before. It's just like to give you the taste of the.
Yeah, Dr.
Dr.
Shanta.
mentioned is good too. Yes, he did mention. Yes,
Yeah, of course.
good,
Yes, she did that.
good. Thank you both of you. Now you can go
Thank you,
back to
ma'am.
your children.
Yeah, I am.